I'm Dr. Brett Langston. I'm a prosthodontist and the owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
One common question I get from a lot of my gym rats and my fitness people and my people that are really adamant about working out and staying in shape, which is great, I love that, is how soon after having an extraction or an implant placed can I get back in the gym? And while I appreciate that, I love fitness, I think it's great, it's very important, you also need to make sure you take an adequate time to let your body rest and heal. My recommendation is at least 24 to 48 hours after the extraction. And again, these are things that you want to discuss with your dentist before the procedure. So especially if you're in a heavy training regimen where you're hitting it 150% every day, even 2 days, there are people that are working out and are just total fitness obsessed, which is great, like I said, but you need to discuss this with your dentist beforehand, because what happens is when we do the extraction, you need to let that area heal. If you exercise right after the extraction or when the implant is placed, a lot of times you're increasing your blood pressure and you can cause that area to not heal properly, whether it's excess bleeding, forcing the clots out, extra exertion, any of those things are not gonna help that area heal. So the primary concern with us is exercising too soon doesn't allow proper blood flow and doesn't allow proper relaxation of the area for proper healing. In addition to increased pressure and not allowing the area to heal properly, when you exercise, think about it, when you're lifting weights or really straining, you're clenching, you're grinding down, and a lot of times you can cause damage to that area subconsciously without even thinking about it. So that's another reason, take it easy. I know it's not what you want to do, but give yourself at least 24 to 48 hours. And if you're one of those people that is going to exercise no matter what, discuss it with your dentist beforehand so you guys can work out a plan to maybe take a light day or kind of work around your exercise schedule to make it most ideal healing. Another thing to keep in mind is if you have sedation, you need to give your body time to recover and get the medicine out of your system. If you go and we get you sedated and you get up there and you run your 4-mile run on the treadmill, there's a good chance not only are you going to get lightheaded and dizzy, you might pass out. And believe me, falling down on a treadmill is not a good look. So please trust me and work with us to schedule your extraction and your healing on a day where you can take it easy, because the last thing we want to do is have you go back to the gym, hit it hard, and cause that healing not to happen, and then all of a sudden we're creating a bigger problem and you're gonna have to take more time off later. So it's one of those, an ounce of prevention is worth a pound of cure. Just take it easy, take that day off, hopefully the next day, or at least take it light the next day, and allow your body to heal itself properly. I'm Dr. Brett Langston, I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.